The Civil War's deadliest diseases were dysentery, which is an inflammation of the intestines accompanied by bloody diarrhea, typhoid, a bacterial disease spread through contaminated food and water or close contact, pneumonia, which is an infection that inflames air sacs in both lungs, which may fill with fluid. Tuberculosis is a potentially serious infectious disease, bacterial disease that mainly affects the lungs, and measles, a viral infection that's serious for small children but is easily preventable by a vaccine. One of the medical procedures of this time was amputation, which was used to cut off limbs to prevent infections or bacterial infections. Tetanus or lockjaw, epilepsy, and tense swelling of tissue caused by bacteria, gangrene, death of soft tissue, records and detailed reports for the first time a complete military medical history. This led to the publication of medical and surgical history of the War of the Rebellion, which was identified in Europe as the first major academic accomplishment by U.S. medicine. A development of a system of managing mass casualties, including aid stations, field hospitals, and general hospitals, set the pattern for management of the wounded in World War I, World War II, and the Korean War. The Pavlov-style general hospitals, which were very well ventilated and clean, were copied in the design of large civilian hospitals over the next 75 years. The importance of immediate and distinctive treatment of wounds and fractures was demonstrated, and it was shown that major operative procedures such as amputation were optimally carried out in the first 24 hours after wounding. The importance of sanitation and hygiene in preventing infections, disease, and death among the troops in the field was demonstrated as well. Penicillin was the first antibiotic found. It was discovered when Fleming began to sort through petri dishes containing colonies of Staphylococcus bacteria that causes boils, sore throats, and abscesses. He noticed that something unusual on one of the dish. It was dotted with colonies, save for one area where a blob of mold was growing. They zoomed immediately around the mold, later identified as a rare strain of Penicillium notarum, was clear, as if the mold was secreted something that inhabited bacterial growth. Alexander Fleming was the first to discover the antibiotic known as penicillin. Penicillin is important to the medical field because it prevents sickness and diseases. The discovery of penicillin and the initial recognition of its therapeutic potential occurred in the United Kingdom, but due to World War II, the United States played a major role in developing large-scale production of the drug. Penicillin was used as an antibiotic to treat infections. One antibiotic that was discovered after penicillin was streptomycin. The bacteria that penicillin killed was called Escherichia coli. The importance of hand washing was discovered in 1847. In 1847, Dr. Ignaz Semmelweis, a physician in the Vienna hospital, discovered that the fatal infections were spread among patients by doctors who failed to wash their hands between examinations. Semmelweis immediately instituted a disinfecting procedure whereby physicians were required to wash in a chloride of lime solution after autopsies and with soap and water between patient visits. Doctors also had to change into clean lab coats before examining patients. As a result, hospitals' mortality rates from the infectious diseases declined. It's important to the environment around us stay sanitary, including so bacteria and viruses do not spread and infect others. Hand hygiene can also come in handy when working with food. Antibiotics work by affecting things that bacteria cells have but human cells don't. Antibiotics are important to us today because they are used to fight infections and infectious diseases caused by bacteria. Sulfamides, they do not act directly by killing the bacteria, but by inhibiting bacterial synthesis for the vitamin B, foliate, which prevents growth and reproduction of bacteria. Aminoglycosides can treat tuberculosis and also inhibit the synthesis of production in proteins in bacteria, eventually leading to the cell death. They are the only effective against certain gram-negative bacteria as well as some gram-positive bacteria, but are not absorbed during digestion, so must be injected. Tetracyclines. Their use is decreasing to increasing instances of bacterial resistance. However, they still find use in treatments of acne, urinary tract, the respiratory tract infections, as well as chlamydia infections. Chloramphenicol is generally only used in cases where infections are deemed to be life-threatening, although it is occasionally used in the treatment of eye infections. Macrolides. They act by preventing the growth and reproduction of inhibiting protein synthesis. Their effectiveness is broader than penicillins, and they have shown to be effective against several species of bacteria that penicillins are not. To prevent bacterial infections, you can look into using natural antibacterials and maintaining good health. Yes, there are good bacteria, such as Lactobacillus, Bifidobacterium, Streptococcus, and Bacillus coagulans. Some bacteria are found in your gut, your mouth, and so on. There are good bacteria that can benefit humans. They are beneficial to your health, and they are available in yogurt or in various dietary supplements, according to the National Center for Complementary and Alternative Medicine. Humans cannot survive without bacteria, our body's host, and the effects of not having the right balance of bacteria. Antibiotic resistance occurs when an antibiotic has lost its ability to effectively control or kill bacteria. We should be concerned because if we need a specific antibiotic and it's now resistant, it won't be able to be controlled or kill the bacteria. The higher levels of antibiotic resistance are mainly attributed to the overuse of antibiotics. An example is a person taking antibiotics to treat a common cold. A way we can prevent this is to stop abusing antibiotics on coughs and common colds. A way we can prevent this is to stop abusing antibiotics on coughs and common colds. Some bacteria are naturally resistant to certain antibiotics. However, there are two other ways that they can become resistant. One is a genetic mutation, and the second is acquiring resistance from another bacterium. Antibacterial-containing products have not been proven to prevent the spread of infections better than the products that do not contain antibacterial chemicals, although a link between antibacterial chemicals used in personal cleaning products and bacterial resistance has been shown in vitro studies in controlled environments. No human health consequences have been demonstrated. Antibiotics have transformed our ability to treat infections. As antibiotics resistance increases, these life-saving drugs do not work as well as they once did, and successfully treating common infections become more difficult. Some common antibacterial products are soaps and detergents, hand lotions, disinfectants, window cleaners, cleaning cloths, surface sprays, mouthwashes, toothpaste, garbage bags and plastic wrap, textiles, and carpet underlays. Some names of bacteria that have become antibiotic resistant are golden staph and the cause of gonorrhea, which is known as Neisseria gonorrhoeae, are now almost always resistant to benzopenicillin. In the past, these infections were usually controlled by penicillin. The most serious concern with antibiotic resistance is that some bacteria have become resistant to almost all of the easily available antibiotics. These bacteria are able to cause serious disease, and this is a major public health problem. They spread so readily because when abusing antibiotics, you get antibiotic resistance. In other words, they can spread readily by using certain antibiotics when not needed. What can we do to control this problem? We can minimize unnecessary prescribing and overprescribing of antibiotics. Complete the entire course of any prescribed antibiotic so that it can become fully effective and not breed resistance. Practice good hygiene and use appropriate infection control procedures. In the future, will antibiotic resistance bacteria be more of a problem or less of a problem? That mostly depends on us. The more we use and abuse antibiotics, it will become more of a problem. Are we the cause of the problem? There are very few natural antibiotic resistant bacteria, but for the most part, we are the cause of the problem. Do probiotics have a role in preventing or treating drug resistance or drug resistance infections? Probiotics could have a part to play in slowing down the spread of antibiotic resistance. Certain strains of probiotics have been demonstrated in clinical trials to prevent the side effects associated with antibiotics.